Welcome to the Cutting Edge Health Preventing Cognitive Decline podcast. I'm Jane Rogers. Welcome back to another edition of the Cutting Edge Health Preventing Cognitive Decline podcast. As many of you know from watching these interviews, one of the underlying factors that can lead to cognitive decline or other age-related diseases like cancer or heart disease are toxins. And getting rid of toxins can be a real challenge because every day we're exposed to them in the food, in air pollution, in the chemicals, the smell from the gas when you're pumping gas into your car. There's a new technology that they are using in Europe that I just wanted you to be aware of, and I think it has possibly some efficacy. It's being done at the Alpstein Clinic, and the medical director there is Dr. Ralf Oettmeier. And we shared an interview that I just found fascinating today. I hope you get a lot out of it too. Dr. Oettmeier, or Dr. Ralf, as your patients call you, thank you for joining us today.
It's an honor for me. Thank you. I like to do.
Oh, excellent. We have so much to talk about. First of all, this podcast audience is very interested in how to prevent the diseases of aging, specifically cognitive decline, but also cancer and heart disease that also, play into our vibrancy as we age. And
Yep.
I learned about a procedure that you are doing in your clinic, the Alpstein Clinic in Zurich, Switzerland, that has efficacy, possibly in this area. So can you tell these listeners about INUSpheresis, what it is, what it's all about, and then we can dig deep into it.
Yes, the INUSpheresis belongs to the group of so-called apheresis, which means a plasma cleansing from the blood. Primarily, it's an important part of our holistic concept to remove environmental toxins, but also a lot of other things I would like to explain a bit later. From the history, the apheresis has a lot to do with the dialysis, which is important for kidney patients suffering from a kidney deficiency or insufficiency. And so we have a device. We need fresh blood coming from the vein, going in the machine. Then there is a separator. It's a special filter system which separates, according to the name, the blood particles, the blood cells like red cells, white cells, lymphocytes, platelets. And very fast, these blood cells and these important components, they were sent back. Yeah, so they are only outside from the venous blood, perhaps 1-2 seconds. And the other part of the separator brings us, I would like to say, the bit dirty plasma to the double membrane special filter system. This is a filter much more equipped with a special covering. It's a jealous surfacing which this filter contains, and it's like a little wonder, but it's true. He can eliminate from the plasma a lot of toxins, of environmental toxins like metals, soft makers, microplastics, pesticides, herbicides, insecticides, and so on. And also he is able to remove antigen, antibody complexes, and this so-called bad pro-inflammatory cytokines. And partially also he removes pathogens or such things like the spike protein, which we know from COVID-19. And the wonderful thing is it was shown by research from a patient from us, which has made the procedure as prevention. And he is a professor for analytic medicine on the University Zurich. And he published also his work. He called us and he was able to show from the filter product has the name Eluate, that in the Eluate he found till 10,000 different artificial substances. Yeah, many substances only in a low amount, but he was able to show that a lot of artificial chemical substances we are able to bring out from the body. We know we have much more artificial chemistry on this world. According to actual statistics, approximately 450,000, but it's a big step in a good direction. And the procedure needs approximately 2.5 hours. And during this time, we filtrate approximately the double amount of your blood. It depends from the body weight, between 8 to 9.5 liters. And so you feel very fast also the difference. This is the wonderful thing of this method. And we are working with the method, meanwhile, since 4 years. And since this time, my beloved holistic medicine makes much more fun than before.
Because you're healing more patients, in your opinion. Yeah.
Yeah.
So let's just back up and make sure that the audience understands how this happens. So you stick something similar to an IV into a vein over here. Then
it's a vein. When the vein of the arm is not well or is not good enough, then we make it with a so-called central catheter system. Here we prefer to use the femoral vein. It's in the upper leg. It's the same vein which, for example, also is used by the cardiologist when they make any cathetering of the heart. And this is also a harmless procedure. It's not necessary to have any fear from it.
So you don't use the arm, you always use the femoral?
Yeah, no, we like to use the arm.
Okay.
But I mean, when the arm has not sufficient veins, we need a good vein, not a super small one. Then we decide quite often, approximately 20-30% of the patient needs it, to use the femoral vein of the leg.
So you put it ideally in the arm if the vein is strong enough. And then you pull out the blood. It's out for 1 to 2 seconds. It runs through a filter.
A so-called separator filter. The name is the separator.
And then it goes back into the other arm?
Yeah, it goes back in the other arm. We have one arm, we say it's the donator arm, the donating arm, and another arm is the receiving arm. Yeah. And then the blood cells go back very fast, within 1-2 seconds. But the plasma needs a bit longer because it's a multi-cascade filter system in the second one. And here we have together with so-called cleansing solutions, we need a bit more time. And then the cleansed plasma, the plasma has also a much better color. It's more bright. It looks a little bit like champagne, I would like to say. This goes back. And on another side, we have a filter product, more and more. The amount increases with the time coming out from the filter and gives us then also the impression which things are in.
And you mentioned that there was a professor at the University of Zurich who had studied this.
He made this analysis regarding the content of the filter product. As a routine, we offer to our patients to make a standard toxic analysis of the filter product. Here we have a palette of approximately 150 parameters, pesticides, herbicides, solvents, and heavy metals. But he, with his high-tech laboratory, he was able to analyze much more. That's why I mentioned.
And let me understand this. So if a patient goes through this, they have the option to see what came out.
Yes, of course. It's not an option. It's a fact. Because a part of the device of this so-called INUSpheresis system is that more and more the cleansing filter is producing a so-called filter product. This goes in a big bag, and then we see also from the color and also from the structure of this fluid very often it's not normal fluidly. It looks a little bit cloudy, and we have also very often on the bottom a little, we say, heavy metal cone, because our earth and the magnetism of the earth brings the metals on the bottom of this filter bag. Now,
in the United States, we cannot do this procedure, INUSpheresis. Is that correct? It's not yet FDA approved?
This is correct. Till now, not the FDA. Till now has not permitted the system. In the USA, you can do 2 other, a little bit similar, but not so effective treatments. One is the so-called lipid apheresis. The lipid apheresis removes from the plasma the bad lipids like cholesterol, like alpha lipoprotein and such things. It's only for this indication useful and it's working. With the lipids, not so easy when you remove and when you continue, for example, a bad lifestyle, very fast lipids come back.
Yeah.
And another one, this was more and more used during the COVID time. It's also available a so-called cytokine-apheresis, which is removing these pro-inflammatory factors, which were also a problem. The so-called cytokine storm was a big problem of the very ill COVID patients in the hospitals. And in the emergency units, more and more also big hospitals have available such, they say, inflammation apheresis. But regarding the super important point with the environmental toxicity, with the load, which is for us a big causative factors for all chronic diseases and cancer, it's not working, it's not effective. The method, meanwhile, is spread for some European countries, but in the North America till now, according to my knowledge, it's not available, unfortunately.
Do you know where it is in the process, or if anyone's pushing it?
I have no information from the company. I'm sure that some people have a big interest and they would like to push. But regarding these details, I cannot tell you much more because I'm working on the basis. The responsibility for the system and also the management is laying now in the hands of a company in Switzerland. Before it was in the Bavarian Wood in Germany, but I cannot clearly tell you if there are running activities in this direction.
So you've done this now for 4 years with INUSpheresis?
Yeah, we started in summertime, exactly 4 years. Yeah.
Okay.
In late summertime 2020.
Who's coming to you for this?
Who is coming? Yeah, on one hand side, there are a lot of chronic ill patients and also cancer patients coming from us. This was also before. And then after the availability of the method, we have, of course, also suggested to do for our chronic patients the method. And on another side, at the end of 2020, more and more also the problem with post-COVID syndrome increased. And we have seen very fast, it was also shown by some research, meanwhile there are existing different publications, that it's a super helpful method for this post-COVID syndrome. And then also more and more separate external patients came to us, that's why. But primarily, the system is incorporated in a holistic scope of our concept, which has 4 steps and which is also important to follow and to continue. When you make the method alone without any preparation before and without after treatment, then it makes not so big sense because we would like to have a sustainable, good effect. And in this direction, not everything can do the method alone. It needs a good indication and it needs a good preparation and after treatment.
So talk to me about the preparation and the after treatment.
Yes, the preparation at first means we would like to have a clear indication. Clear indication means that we make at first a classic analysis of toxicity, of toxic load. Yeah, there are different methods available. We prefer, when possible, measurements in the laboratory. We have the slogan, things which are possible to measure, you should measure. And we are working together with some very good laboratories here in Europe, not only in Switzerland. Switzerland is too small for this. And then we see very clear, is there indeed a toxic load? Because, of course, we need also a patient which is motivated and which would like to do any work to get a better situation. And then we look, of course, also when we have a chronic inflammatory disease, for the cytokine pattern, the balance between pre and anti-inflammatory. And also, meanwhile, we have the possibility to look for different specific autoantibodies. This I forgot to mention, we can also remove autoantibodies. Yeah? For example, post-COVID and some other neurological diseases which are connected with cognitive problems, problems with the cognition, concentration, finding words, and so on. They have very often in the blood so-called muscarinic and adrenergic antibodies against brain structures, against receptors of the brain. And it's a little wonder, by using the INUSpheresis after 2 treatments, in most of the cases, they are completely removed. And then the patient feels very, very fast the improvement also. So we look for in infectious parameters for the toxins. Of course, we need also a more or less good hematology. We can do the method also when we have a bit anemia, but it should be not too much. And we look for the blood coagulation parameters. Yeah? This is also clear because during the method we administer a classic remedy, a classic drug, which with the name heparin. I'm sure you have heard it.
I've heard of it.
It's a little bit. It's a blood thinner, and depending from the coagulation parameters, from the body weight, we use this. We use this in the preparation phase also to make a good assessment what's on here. Mm-hmm. And when the indication is clear and when the patient is then wonderful motivated, then we start.
There are those who say, wait a minute, to go over to Switzerland and I'm going to put out, I don't know, $6,000, $7,000 for something, $8,000 for this?
Yeah, in this direction we are when we make 2 treatments. Yeah.
Okay.
The background is that the filter system alone, produced in Switzerland in the famous city Lausanne near the Lake Geneva, costs approximately $1,000. Only the filter alone. Yeah. And then you need appropriate staff which has also experiences in intensive medicine care. And you should have an anesthesiologist or a person with a long experience in the field of intensive care medicine. And there is a lot of things around, and we have also a protocol of cleansing solutions. And also at the end, we administer, for example, an amino acid infusion to optimize the protein level and to push also the protein production in the liver. And so everything around, then we need for 1 treatment approximately 7,500, and for 2 then the double.
Okay.
And depending from the things which you need before and after, it can be a bit more. And we have a unique also part of the treatment which is very attractive for our patients. We make before and after also a microscopical examination in the so-called dark field microscopy, and then we see often intensive changes of the blood quality. Before you have blood with also clots, or you have blood with so-called Rolleau phenomena, sludge phenomena, you say in English also, and after the blood cells are swimming more or less alone, they are not so sticky, the plasma is totally clean. This is very often super impressive, and the patient, they can get the video, they can get the photos of this also, that they see, okay, this happened with my blood. And it's important also that they believe which things now are in her body running.
Mm-hmm. Are there any concerns that someone should have considering this procedure? Have you had adverse reactions?
This is wonderful. I have here a table which is very good wood. Yeah, we say in our language, we knock on wood. We made, I would say, when I estimate perhaps 3,500 treatments meanwhile, and we had never any problems and side effects. Yeah. Sometimes when the person is a little bit has an underweight or has very low blood pressure, we need a bit longer till the person feels good enough also to go. We let the person a bit longer lay, or she get an additional infusion. But when you work accurate according to guidelines, nothing can happen. Yeah? And that's why also a preparation phase. I forgot to mention, of course, the responsible doctor before the treatment, minimum 1-2 days before, he makes also an appropriate long discussion, and he speaks about all factors which are from importance and which the patient must know. And they collect in the beginning a long list of questionnaires, over 40 different questions regarding all diseases from the past history and so on. And after the assessment, then they estimate the risk. And in most of the cases, it's not a problem to do the treatment. And in a very few amount, we must say, sorry, the risk is too high. We cannot do such a case. We had, for example, this week, it was more a younger person suffering from a special kind of a brain tumor. And there was a risk of swelling. And that's why we could not do the procedure. It needs perhaps more preparation, or at first he shall prove to look for other possibilities. But severe problems that the patient must go to a hospital or to an emergency unit, I'm very happy to say, and this is true, till now we never had.
Excellent. So I was turned on to this, or found out about it, because in this country we try to do chelation to get rid of toxins and heavy metals and things like that. But chelation, my understanding is, can be hard on the kidneys. And that's why something like INUSpheresis, that does not involve the kidneys to that extent, is good for some people. Is that correct?
Absolutely. This is a very logical thing which you have asked also. I say to the patients during this procedure, the kidneys, they have holiday because they have not to do so much. And on one hand side, we appreciate the chelation. We have different chelators also, which we use every day. But important regarding also the chelators is, you have totally right that we need a normal good kidney function. And also we must pay attention for the trace elements, because the chelators can also remove different important trace elements like selenium, like zinc, like manganese, like molybdenum, for example. And that's why when we do chelation, then we administer at the end also a small bottle of trace elements that they not fall down in a deficiency. The problem is, I would like to be very open, that with the INUSpheresis we do not reach from the inorganic metals so much. Yeah. Also, the mentioned professor, he checked the amount of detoxed metals, and he found a significant increase. But especially we reach the metals which are bound on protein, or which are bound on other organic substances. Yeah. The inorganic metals, from the molecular weight, from the size, they are not different to our normal minerals which we have in trace elements. And these elements, they go through the filter. When you allow, I would like to mention, before we have started with the method, on one hand side, I was super delighted from the idea, but I was also a bit skeptic. And that's why before I started with my own INUSpheresis 2 sessions, I made in our laboratory everything from lab which you can measure. Yeah. All minerals, trace elements, vitamins, amino acids, fatty acids, everything. And then 1 week after the treatment, I repeated this laboratory complete, a long list. Yeah? And I was deep impressed. Almost all things were still normal. There was only a reduction of the bad fat components, which I have also a bit like cholesterol, alpha lipoprotein, and so on. But one factor was significant lower, and this was the total protein. Yeah, and that's why especially also the women with a little bit more soft tissue, they feel the first, sometimes the second day also a bit a puffy feeling in the face, and sometimes they have a bit more swelling of the fingers. This is the following of the reduction of protein which can happen. especially when you have a lot of so-called bad protein swimming in the plasma. But we push with the mentioned amino acid infusion this new reproduction, this reproduction of protein from the liver, and very fast this little phenomena disappears. This is important to know and to underline.
INUSpheresis seems pretty state-of-the-art. Is there anything else that's coming along the pipeline that you're hearing about? Because getting rid of toxins, if you want vibrancy as you age, toxins are all around us. They're in our environment. They're in the food we eat. They're just everywhere. And it leads to chronic disease. So It's important to get rid of them. But have you heard of anything coming along that might even work better than this in the near future?
You mean if the method has also for the future a big importance also in prevention?
Mm-hmm. It does have an importance in prevention.
Yeah, because I think, and you have in your in the States, you have a very good information platform belonging to the CDC. Yeah, and the name is ATSDR, Agency for Toxic Substances and Disease Registry. I can only recommend to study this webpage when there's a rainy day and when you have time. And they publish, and every year it's actualized all important toxins for all different diseases and also for organ systems. And the best prevention in my eyes is, and this was also shown by old classic biology and cell research, is to have as low as possible toxicity. And I mean the chemical toxicity, the own-made toxicity, and also the emotional toxicity. And with our system, we can influence the last not so much, but the other things we can very good remove. And that's why more and more we have also, I would not say patients, we say then clients here, they make it for prevention. And it's a wonderful method. You can combine it with everything which makes also sense around. And in the next days, a new doctor will start in our clinic. She comes from the field of cardiology, and she is a cardiologist, and she takes care also for the vascular system. And she is super happy to learn, to practice the method, and then to use it for cardiovascular diseases, especially also prevention and as an after treatment when you had a heart attack or other problems.
Okay, back up. So she's going to use this INUSpheresis, this way of cleansing your body of toxins, to be able to help the cardiac system, even after a heart attack. Please tell me how toxins play into that.
Regarding heart attack, I'm very proud because I know from a study which is very new. I think it's a publication from this year coming from this super famous American Heart Association. And they have published a study with a lot of patients which they analyzed regarding heavy metals and risk of cardiovascular diseases, especially also coronary diseases. And there was a clear correlation. There was a significant situation that the more you have especially lead, cadmium and mercury, the higher is the risk to get such diseases. And we know also more and more people which have, when you look superficial, a healthy lifestyle, no smoking, no alcohol, quite health nutrition, but despite they develop these diseases. Yeah, of course, also the stress plays a role, but we must more and more see that this environmental load in the complex is so important. And when we look for the numbers, also for the amount of all these chronic problems, we need such systems, I would say, in the future in every big medical department. This is my dream. Also, I hope that the FDA, I'm not sure is it possible to say, which is perhaps a little bit influenced by pharmaceutical interests, also will permit it in the future. They will not come around, because when the people would like to have and when the pressure is increasing, I'm optimistic for you.
Thank you. In a perfect world, And we're bombarded by toxins every day. How often are people coming to you for this procedure? Is this a one-up thing and that takes care of it, or you come every 5 years, or what?
It depends, Jane. Absolutely clear. On one hand side, when we have a severe disease, which is chronic, which is not so easy to influence, I think for such dramatic indications like, for example, ALS, amyotrophic lateral sclerosis, or severe also situations of Parkinson's disease or of Alzheimer's disease, then it's often necessary to repeat more often. With repeating often, I mean every 6 months, for example. Yeah. In a case of a person like you, which is quite healthy, which likes more to push it in a direction of active prevention, it's absolute not so often necessary. I would recommend to make it perhaps every second year or so. I'm on the source. I make one treatment every 6 to 8 months, but this is only because I'm here. I'm on the source. But it depends at the end from the area in which you live. It depends from the lifestyle, from other also exposures towards toxins. This is clear, the point. And I have sometimes also persons, managers, they tell me, oh, Ralf, sorry, so often I have to go to business dinner. I must traveling a lot, and I'm also in countries which are much more dirty, like China and so on. And then they come every year, also for prevention. It's an individual decision, I would say. And then the most of the people, they feel it also. They feel, now I have the impression, when I look for my memory ability and for cognitive function, I have the impression I must repeat.
Mm-hmm. Mm-hmm. You can feel, or your clients can feel when that happens.
At the end, when you feel the difference after the treatment, which is often very significant, then you know it, then you remember for it, and when it's more and more worse, then you say, okay, I must go back. Regarding the time, allow me to give you also this information. We have approximately, we made also our own studies. We have approximately 20% of the patients, they feel the big difference within 5 days, very fast. And during this 4 years, we had also 2 persons sitting in the wheelchair. They stand up within 2-3 days. This is a wonder, I know. They are not so often. It's enough for me to have a small wonder, a little wonder. This can happen. But most of the people, they have the benefit within 3-4 months, which is very logical when we think also for our anatomy, physiology. Because we have not touched the cells. We have also not cleansed the cells. We clean only the plasma. And the cells, after this, they have much better living conditions. And in this direction, then we must wait for the self-rejuvenation. And for example, white blood cells, they are after 1 week complete exchange, complete new. The red cells, they need 3 months. And inner organs like liver, kidney, lungs, they need 6 to 9 months. And this is also the span which we must take in consideration. That's why in many cases we feel not so fast the improvement when we not make any other combinations. Meanwhile, we found a lot of useful combinations to improve faster. But when you do the method alone, you must have, in many cases, a bit patience.
Mm-hmm. Can you think of any other studies that you can cite that shows the efficacy of INUSpheresis?
Yes, regarding the method, there are existing, meanwhile, a lot of studies. When you would like, I can send you, of course, also.
We would like that to post so that people can learn.
Primary, we have studies reducing also all different cardiovascular risk factors. There are existing minimum 10-12 studies. They were especially also written by the founder of the system. It's the guy, Mr. Straube. Meanwhile, he is in pension from the Bavarian Wood. And then we were a part of the study. We are very proud about, together with a German university and London King's College, regarding the effect in post-COVID cases and regarding the effect of different metabolic diseases. And and then this guy from Zurich, he published two works in the direction of, on one hand side, the removal of a lot of toxic elements, which he was able to show also with impressive pictures. You can see it with electron microscopy, for example. And he made a research regarding the effect, which is in my eyes also a little revolution when we think about anti-aging, for example, or I like to say well-aging. He was also able to show the difference before and after the treatment regarding the structure of the water clusters in our tissue. Yeah, we have in our tissue a lot of water. How you know, our body consists from 70% water, and the water on the surfaces in the cells and in the tissue is structured. Yeah, it's a so-called quasi or pseudo crystal water structuring. It sounds a bit complicated, but also in the US you have some very good water researchers, for example, Professor Trincher. And he was able to show a clear difference before and after. He interpreted as an effect that the water phase in the body is more cleanser and is more or better structured. And this is at the end connected also with the quality of the tissue, with the quality of the skin of the subcutaneous area. And it has, I'm sure, it's my opinion, also to do with the compartment of the lymphatic system. But I can send you all this research.
We'd like that, because this group tends to like to do a lot of reading. Thank you.
Yep. Yes, I make a note and I will send.
Oh, thank you very much. So, have you done more labs? You mentioned labs saying, okay, do I still have the same minerals that I had before and after the INUSpheresis treatment? Yeah. But I'm sure you've done this. And studies have done it, the toxic load, because I just had a recent toxin test done, and I'm above average in my toxins. And if I were to get something like this, I would hope, if I retested, that my toxin load in that same test would be significantly less. Have you found that?
Yeah, this we have done. We made a little study with over 70 persons, 33 patients, they had a cancerous disease or cancerous background. And it was very good to show. We made, within 6 months, 3-4 analyses of the toxicity load. It was very good to show that it's high significant reduced. Mm-hmm. And also in this direction, when you would like, I can send you something also from material. Also, I can send you also a presentation which I made on an international congress last year. And this is very good to see. One thing is important to know: when you make the control very near to the treatment, then you can see often also the effect that some toxins, which are now more released from the cells, from the tissue, are in a higher concentration circulating in the system, in the blood or in the urine. So it's necessary to wait longer, minimum 4-6 weeks, till a new steady state is installed, I would like to say, in the body. It's a technical term, I know.
Dr. Ralf, you must be excited every time you come to work. I can tell. You're passionate about this. You're enthused. You think this is the right modality to help people.
Yeah. No, that's why I hope you can a little bit feel and hear. I like it. And since we have it available, it makes much more fun, because I am a doctor which would like to have the biggest success for my patients. It's not a business for me. It's a passion, perhaps I would like to say. So more people say, "Oh, I'm so satisfied. I have an improvement. I'm better." The better.
That's all you want. Yeah. So if someone is considering this modality, it's called INUSpheresis, INUS, INUSpheresis. And you are the Alpstein Clinic, and you're right outside of Zurich?
Yes, we are 1 hour far away from Zurich. Yeah.
1 hour, okay.
Zurich is the capital of the German-speaking region of Switzerland. We are quite near to Austria, to Germany, to the Lake Constance. It's a wonderful area. That's why also our name, Alpstein, is the name of the mountains which we have here when I look out from my window. And the rocks of this part of the Alps they have the name Alpstein. Stein is in English stone. Yeah?
Oh.
And and the people enjoy also when they are here the area and the wonderful scenic view. And we are more, compared with many big cities in the US, we are more rural. We have only a little village around. The next bigger city is St. Gallen with only 70,000 inhabitants. But we like very much this area. Yeah. And
I must say,
it's perhaps an idea for such a journey.
I was looking on your website, and the picture you have of your staff, it looks like a staff of 40 people, and they're all standing on some alpine meadow, looking at the Alps behind them with these beautiful Swiss chalets. It's pretty idyllic.
Yeah, absolutely. No. Yeah, it's at the end, it's perhaps a part of our success rate that also a little bit this wonderful area here has importance. Yeah. And the air is very fresh. This village in which we are was a very famous cure village 100, 200 years ago for the so-called way cure to treat tuberculosis with the clean air, and then also with the whey, which is probiotic for the intestines and for the gut. And that's why everything here is made to get more healthy.
That's why you haven't moved to the big city and moved your clinic.
Yeah. No. It has also a bit to do with the medical authorities. Also in Switzerland, like in the US, we have a lot of different areas with a different law. And we have the best of Switzerland. Also, that's why we are here.
You know, before I let you go, why is it that, and maybe it's just me, but I am finding Europe seems to have a lot of the cutting edge things before the United States. Why is that?
Yeah, it's not so easy to explain. According also my dialect, I'm sure you know, primarily I come from Germany. And Germany, a long time, meanwhile, is unfortunately more and more going down. It has a lot of natural medicine traditions on one hand side. We say traditional natural medicine. And then we had in Germany and also in the neighboring countries a lot of innovative new developed systems which are super helpful to overcome this so-called modern diseases and cancer. And in this field, it makes not only fun to learn and to get the appropriate training. We have also in this direction a positive historical burden, I would like to say. And such methods like homeopathy, like plant-based medicine, phytotherapeutic medicine, like anthroposophic medicine, like hyperthermia, for example, coming from this famous center from Dresden, Professor Arden, we got the Nobel Prize. And also organopeptide therapy, another Nobel Prize from Professor Blobel, came also from Germany. Later he worked in US. Since my studying, I had the possibility to learn a lot and to practice a lot. Yeah. And also similar like in the US, we have also incorporated TCM, acupuncture and all these things. And I like to learn. I like to make also education. And then I have collected a lot of this. And we are a big community in this Middle European countries in this direction. And we have a good intense exchange. Tomorrow, for example, I go to a European Biological Medicine Congress to Germany. And so we have good activities. Yeah. And also in Switzerland, the interest of the people here is very high to incorporate in the medical system natural and holistic medicine. And some years ago, you know, Switzerland has a special kind of democracy. They made a people election, yeah, and they decided with over 60% yes, we would like officially the incorporation of natural medicine and holistic medicine in our also system of health insurances. And that's why also many things which we are doing here were overtaken by the Swiss insurances.
Oh, that's amazing.
And this is the terrain, I would like to say, for our work.
That would be nice. It is a good preventative. Dr. Ralf, is there anything else you'd like to add as we wrap up? You've been so generous and so kind answering all these questions.
If I shall mention some more, you mean?
Yeah, is there anything else? Anything else you want to talk about before we say goodbye?
No, I think I have...
You've covered it.
And of course, we have many other topics which we like very much. For example, we are also an important, famous center for using and practicing artificial and also active fever therapy. We like the use of high temperature to treat. This is one of our main point. And I mentioned beside, we can reduce also the distance between INUSpheresis and the success, for example, by combination with whole body hyperthermia and the increase of the inner body core, because we do it on the day between the first and the second treatment. The first treatment is removing most of the, I would like to say, biological waste from the plasma. And then there are 1-2 days gap. And on this gap day, we mobilize more biological waste outside from the vessels, from the tissue, from the cells, from the brain, by using whole body hyperthermia and some specific infusions. And then when the second INUSpheresis starts, then we cleanse again also this new mobilized toxicity from the system. And then we have a faster effect. Yeah? Such things we like. And this combination is quite unique. Not so many centers have it available. This I can perhaps mention. But of course, at the end, we like our work. I have a wonderful staff. And yeah, in this direction, I can only say we are open.
So you do thermal, you do cooling in between and put them in like a refrigerator type thing, or do you do it with water?
No, we warm up.
Oh, you warm.
We make hypothermia,
not hypo.
Artificial fever. Yeah, our body core temperature has 37 Celsius. It's approximately around 100 Fahrenheit, I assume, or 99. Mm-hmm. And then when we increase, this is a natural process. Also, our little babies, when they have an infection, they develop fever. Mm-hmm. Yeah? When we increase to 103, 104, then we push intensively many mechanisms parallel. And this we can do with another device from Germany, or we make it induced by a fever remedy, IV, that the patient makes it active. And this is then a very intense also push in the system to mobilize and to increase especially the immune system efficiency.
Fascinating.
Yeah, such things we do. Perhaps you have seen also something on the webpage.
Dr. Ralf, thank you.
I can only say thank you very much for your interest. When there is more interest, let's do it again.
Chat more. Excellent. You have a great day, okay?
And I promised you, I sent you the appropriate studies, that you have some more material. And it was a big honor.
Thank you. It was an honor for me too. You've been listening to the Cutting Edge Health Preventing Cognitive Decline podcast. Any information shared here is for educational purposes only. Guest opinions are their own. This podcast is not responsible for the veracity of their statements. Do not use any of this information without first talking to your doctor. Cutting Edge Health, LLC, is not responsible for what may happen to you if you use their information in place of official advice from a medical professional. Thanks for listening. Be well.